All right, we're live. We're good to go. Hey everybody, this is Dr. Bulow, and I'm here with Amanda Thomas, Doctor of Physical Therapy with Kinetic Pelvic Health.
Yes.
Right? Awesome. Newly minted brand,
Yes.
relatively new to the North Pittsburgh Cranberry region, right?
Yes. Yeah. I was in the North Hills before.
Got it. And you worked with UPMC, did I hear earlier?
Yep.
Very cool. So we're going to dive in. We're going to chat about it. If you're new to these conversations, they've come in different brand names before. So we kind of recently rebranded. We were just talking about this as Pittsburgh Providers. So this will be on the Pittsburgh Providers podcast, the Pittsburgh Providers Facebook page. And if you're new to the area and you want a place to connect with like-minded patients or professionals, you can look up Pittsburgh Patients on Facebook, Pittsburgh Providers, and connect with Amanda. I'm sure you'll be able to answer questions in the comments section. We have other interviews that we've done over the past. Today we're actually hanging out in a room with Laura Ellis and Larry Schultz and Dr. Amanda Savage, who works with me in the Revive Clinic. Emily. Oh, gosh, Amanda's. But point being, we've interviewed just about everybody here, so if you want to catch up, go back. But meanwhile, today, what we're going to do is get to know you, Amanda, a little bit.
All right, cool.
So look, why don't we start with what we were just mentioning. You worked for UPMC.
Yes.
Well, maybe before we get to that, please give everyone the nutshell of what you do.
Okay.
And then I'm curious how you got to that point. But for those that maybe never heard of anything or yourself, kind of how would you describe what it is that you do for folks in the community?
Okay. So I am a pelvic floor physical therapist. We work with the pelvic floor. So basically kind of lower back, pelvis, core, but kind of integrating the whole body. I specialize in pregnancy, postpartum, and pelvic pain. So my passion is women that are pregnant, postpartum, or, I mean, you can be postpartum when you're 50 years old. And then patients who have like chronic pelvic pain.
Gotcha. So, and this is, I almost forgot as we got into this, what I try and do is, well, let's dial in on that in terms of what types of people you see. And we'll spend some time on a surface level, like in terms of like just the standard mom or expecting mother and what they should look for and how they would know and all that kind of thing. And then for those that really want to geek out with us, we'll dive in a little deeper on a clinical level for clinicians in the area to know what should they be looking out for from a clinical perspective, because clinicians kind of see behind the curtain in our patients' lives, you know what I mean? But just and if I heard you correctly, a lot of the patients that you see are expecting mothers or mothers who had just recently delivered their children and whatnot. Yep. And so I suppose a great place to start would be those expecting, you know what I mean? So you work with pre-delivery, that sort of thing?
So I'll see some people who literally think they have no issues. Like they'll come to me for like labor and delivery prep. So we'll go through like different positions that you can labor and deliver in. How to protect the core, how to protect the pelvic floor. And then, so I'll do like an eval or education with that. And then usually I'm also finding things that they didn't even know were there.
Just like weaknesses or instabilities or things like that?
Weaknesses or muscle imbalances. Just ability to kind of like control the pelvic floor, control the core in coordination. But let's say a person just does have issues. So some in the pregnant population of what I'll see is like low back pain, pelvic pain, hip pain, pain with sex, incontinence, heaviness, constipation issues. I feel like that's probably the pregnant population. Postpartum, like a lot of times if you have a C-section, people have C-section scar pain. Pelvic pain with regards to like pain with sex. What else? Incontinence, diastasis recti, which is that abdominal separation. Normally that should close. Some people it doesn't close. So just like working to kind of close that. Even just like return to exercise. People who don't really think they don't have any issues and they just want to get back to higher level exercise. So we'll do like a screen of that and teach people how to like use their core correctly again and integrate the pelvic floor and the core. Trying to think if I thought.
Man, you were gonna cringe when I tell you this story, and this is what's fun for me about doing these. I get to ask my questions first, like
Go for it.
Selfish questions that I want to know. But I have to share, and this might hit some people. because I'm sure I'm not the only one, but at the time I definitely felt like the only one. Like one of my biggest regrets, biggest like failures, I kind of carry the weight I carry, is my wife had 3 cesareans, which I always try and explain to patients that's really rough on mom and it's also rough on baby. Just a lot of pulling and tugging where it's not really designed to be that way. But within a month of having our 3rd cesarean, or my wife having her 3rd cesarean, we thought it'd be a great idea to do P90X.
Oh.
And not just any P90X.
Within a month.
Within like a month. Ab Ripper X, which is like this intense, like just ridiculously intense workout program for those that may not know what P90X is. And the next morning she woke up, couldn't move her leg because she completely blew her disc. And so it's like, as a chiropractor, that's like, like one of my biggest guilts.
Just one
one session. Because my wife never had that background anyhow.
Yeah.
And we were just flying into it like a bunch of rookies.
And those programs start like pretty high.
Oh my gosh, insanity. And but it just goes to show the importance of rehabilitating properly after a major surgery, because my wife had a completely fully ruptured disc.
Well, that's the problem with C-sections too. Like the culture is like, you need to be back. Like even after vaginal deliveries, they're like, all right, within 2 weeks, like you should be up and walking and like doing all this stuff. And it's like, no, like you just literally, like your body just made space for a human to come out. Like you're not gonna be like up running around in 2 weeks. And C-sections too, insane, like it's a big surgery.
Yeah, we had in chiropractic, there's a lot of obviously holistic approaches and philosophies to life and health and whatnot. Yeah. And there was Dr. Savage went to Sherman College. I was a fellow Sherman grad that I think graduated a year around when Dr. Savage graduated. But I just remember seeing on Facebook, she stayed in bed with her newborn for I think a month, like literally in bed. Like her husband would like bring her food, do everything, but they were like, this is the way it was in nature, this is the way we're doing it in our home. Like she had a home birth, the whole 9, but she literally stayed in her room, in her bed, like for I think it was a solid month. Just to bond and like all that kind of stuff.
The one I like is the 5-5-5 rule. So like 5 days in the bed, 5 days like in the room, and then like 5 days like you can go downstairs, you can like walk around the house. But like, I mean, that's like 15 days of not doing much.
Yeah, Larry.
How long, typically, based upon your background and research, does it take for the pelvic floor to reset? So when the relaxin sort of kicks, when the ligaments begin to reset themselves, how long does that typically take after birth?
So it depends on how long the person's breastfeeding for.
Oh, interesting,
So with breastfeeding, the hormones are kind of all over the place. Usually after a year is when we see that kind of level out. The American Academy of Pediatrics recommends, you can't control when you're pregnant. Well, you can control when you get pregnant and stuff, but like sometimes people just don't, and accidents happen. And no child is an accident. Let me go back. But basically what I'm saying is like they recommend waiting until 18 months to start trying. Like if you're going to plan out how far you want your kids apart, 18 months.
So you just give that time.
Yeah, to like get back to normal before getting pregnant again.
So theoretically, within that first year of post-delivery, you're still rather unstable.
Yes. Yeah.
Does instability last longer than a year?
I guess.
Normal situation.
I guess it depends on what the person's doing. Like if you're not doing any form of exercise or like strengthening or anything, then potentially it could last longer, I guess.
So I want to get into some of those pieces of advice. I think that'd be highly valuable for people hanging out with us during the conversation, watching the playbacks, all the rest. But chronologically, before I forget, if you don't mind, you mentioned going over with expecting families, expecting mothers, the different birthing options they have.
Yes.
And that's another thing that I'm like, I would love to dial in on that because I'm so incredibly fascinated. Because again, I'm sure it's not just in the chiropractic world, but in my ecosystem, we see it with our colleagues that are very holistic and natural and all that kind of stuff. A lot of these home births, water births, and all the rest. To Larry's point, like, are there different positions that are better or worse for mom from a pelvic stability standpoint, and then also different ones for baby? You know what I mean?
Yeah.
Like, and is there research, or is that just I mean, how does one approach that decision if we take away the maybe the induced fear and anxiety out of it, but what is the community, what has history shown has been some of the more beneficial models?
I mean, babies are going to do what they want. You can do things to encourage like them to move and turn, but I always just kind of like, if a baby is breech, you could try to turn it. If they're not turning, there's probably a reason they're in that position. So in that regard, like, baby's just going to kind of do what they want. But we can help by doing like pelvic opening type exercises during labor. So like side lunges can open the pelvis on the side, like the side you're lunging towards. Being up and moving is more ideal than being sitting or laying. When you're actually pushing baby out, side lying or on hands and knees is most ideal for the pelvis to actually move. So like for the sacrum and the coccyx to kind of open up and baby to come out. But like if you've been laboring for 40 hours, you might feel better on your back, and that might allow you to relax a little more. And so it kind of depends on the person. There are ideal, so like hands and knees, sideline is ideal to allow that pelvis to move. But things happen. It's never usually like
nothing's ever
perfect.
what you plan.
Yeah.
Any resources that you've come across other than obviously coaching, mentoring, preparing with professionals like yourself, but are there books, documentaries, and things that you've come across that are pretty good for public consumption? Because I don't know. This is mansplaining on my part. I have no idea. But my perception is there's a lot of fear and anxiety around what is otherwise a very righteous, amazing, miraculous process, but it's been turned into a medical procedure. You know what I mean? Like,
I mean, I don't necessarily think social media has been great for the birthing process, just because like what you do see is like fear. Like, I know when I was pregnant with my first, like I was reading, like something popped up on my Facebook about SIDS, and it's like, and then you like start reading that and you're like, oh my gosh, like how is my kid gonna live? And so you almost have to like avoid the triggering things. But I just feel like there's one really good movie on Netflix that I'm blanking on the name right now.
Business of Being Born?
What was it? What?
The Business of Being Born.
Yeah, I felt that was like a pretty good show.
and
Just like that, like encourage you, like you can do this. Like this is the way we're designed.
Was and if someone didn't hear, Laura was saying The Business of Being Born was one of the documentaries.
I think it was that one. It was about the home births.
I think so. I actually didn't watch it. I've seen clips here and there.
There's one about a home birth.
The Business of Being Born might not be a building up movie. It might be more of a tearing down movie in the sense that it's tearing down the medical structures that have been built and turned pregnancy into an industry where you're getting a predetermined delivery date that's a cesarean, or they're going to induce labor or what have you, because it's turned it into a business.
I'm thinking of one that it's about a home birth, and it's like this woman's journey with home birth, and it's very like motivational. I can't remember what it's called. But
I'm so intrigued about the fact that there are optimal positions for changing the pelvic structure during birth. Like I would think that 90% of the women out there think that the only option is in stirrups on your back, or even if you're doing more of a natural thing like that. It's like, I don't even think about that. I mean, I was going to ask you about, is there any benefit to underwater births?
Yes.
These alternative versions that are out there that people tend to shy away from because they're fearful. But it seems to me that the old party line, well, women in China are squatting in rice fields and delivering babies, and it seems to work okay. So you have that extreme, and then you start thinking, well, geez, are we just taking advantage of all of the technology that we have, at least understanding-wise, that there are ways that we can make this birthing process less traumatic?
Well, even like going back a little bit with birthing positions, like in the first stage of labor, I mean, having your legs open, like external rotation is better because it allows the top of the pelvis to open, and then when you're pushing, having internal rotation to allow the bottom of the pelvis to open is helpful too. And people are doing that without even like realizing they're doing it. Like their bodies are just kind of moving in that position. What was the second part of that you were saying?
Just alternative versions of birthing, like
Yeah.
underwater birthing or.
Yeah, so I don't know a ton about underwater birthing. Statistics do show that the babies have higher APGAR scores. I've never had a water birth, so I don't know, like I can't speak from experience. But people say it's beautiful and great, and
Well, the cord stays longer and they.
yeah,
they
well,
bring
that's
through the-
another thing that's changed too. Even with land births now, they'll leave the cord attached to the baby longer until it stops pulsing to allow the oxygen to come.
We thought back when my first child, we had a birth without violence. It was a Laboyer thing, and we thought it was going to be great. It was, but the aftermath of what he predicted would happen with children would be less anxious and things like that. That didn't necessarily translate. But leaving the cord, letting the cord hang until it simply stopped functioning, and
Yeah.
that was health. That was a beautiful thing.
Yeah.
Yeah, I remember my mom one time. She had a picture. She had a couple home births, but when she was in the hospital with me, she was holding on to the monitor, and she, I think, was the originator of the RBF, the resting bitter face, we'll say. Yeah. But she was so angry that she was in the hospital. She did not want to be in the hospital at all. And I just remember when she was explaining that photo to me, she's like, yeah, I mean, if you look at nature, and when, like you're saying, when people deliver, whether human beings or other mammals, you're not getting strapped to machines with 10 people around you and monitors ringing. Like, that puts you in that state of fight or flight.
I think
you know what I mean? Like,
the education for first-time moms is really important. Like,
yeah.
I feel like you just don't know enough to know when is, if you are going to do a hospital birth, you just don't know when to go to the hospital, or because you've never been in labor before. And so it's just I think education is really important on you can labor at home until this point, and then you're going to go to the hospital, or then
So when you and I know you mentioned, maybe you didn't mention this earlier, but for those that maybe are totally new to this space, can you break down the roles that you fulfill in that process for new moms, and compare and contrast that to other members of the pre-delivery team, we'll say, that people are used to? So you have your OBGYN, you have your doula, which you are certified as?
I'm a postpartum doula. So I specifically work with moms and babies after a baby is born.
Got it. So what are the best resources for the new moms for the stuff that you just talked about in terms of the education and the pre-planning, to have that confidence, but with some natural options? Because they probably have some within the hospital system, but they're all going to be within a certain light.
Yeah.
What kind of organizations or professionals would you recommend people potentially look into if they're looking for a more natural kind of game plan?
Yeah, I think doula is, I guess, knowing who your providers are. So if you're doing a hospital birth, knowing the philosophy of the OBGYN, are they going to push Pitocin on you? Are they going to push an epidural, push a C-section if things are going, if they're difficult, if things are difficult? Or are they more likely to step back and just kind of let you labor? Doulas are really helpful because they know your plan. So their job is to support mom and husband in a sense that they know what the parent wants, and if things are going one way, they might be all right, we have time to stop for a second, let's talk through what you want. There's these two options, let's decide what you guys are comfortable with and go from there. So I definitely think having a doula is good, and a doula that you vibe well with, and like-minded. You don't want a doula that's one way and you're the other way.
And so typically you would start then with your OBGYN, and they probably have a network of doulas and midwives that they kind of integrate with?
There's a lot. So some OBGYNs have doula groups that they'll work with, but you can basically find anyone you want. Just
How do you spell
Googling
doula?
it. DOULA.
And I'm not familiar, that seems to be a comprehensive grouping of people that are in the pregnancy.
Yeah, so they're
domain.
not healthcare providers, but they're more support people. So they know positioning, they know they kind of know the whole birth world to support.
So you're
the mom
unique in
and
the
them.
sense that you are a clinician that also does that type of work.
Yeah, so I do. I don't do birth. I'm not a birth doula, so I'm not at births. That's once my kids are in school stage.
Do you have a captive audience with midwives? I would think that working together you should be a great team.
Yeah, and postpartum doulas too. So we're more in the home after baby's born. So specifically for postpartum doula, like we're helping with like breastfeeding, postpartum nutrition, like making sure mom is getting the food she needs, helping with like basic cleaning, laundry, maybe emptying the dishwasher, like older sibling care, like if mom wants to jump in the shower, we'll watch the baby. So just like things that help make the transition with an infant a little bit easier.
I just think that I'm wondering why you're not focusing more prior. I mean, it seems to me that the ideas that you just presented, you know, this most recent presentation gives me the idea that you're really valuable on the front end.
Yeah, so for the physical therapy aspect, I'll do like labor and delivery prep. So like that would be something that also I would recommend to pregnant women to get to a physical therapist. Like have a pelvic floor assessment, learn how to use your core, learn how to use the core and the pelvic floor together, learn how to like move correctly. I don't know, just like learn how to push, learn different labor and delivery positions. Like so in that regard, I see women before. And then I'll see them postpartum for like the physical therapy aspect, which is more medical, versus the doula, which is more like support.
But I'm just sitting there thinking that you were mentioning that you want to create an environment where the patient or the mother relaxes. So if they know all the information that you have the ability to present to them prior to delivery, that should it should empower them to feel like they have a whole lot more control over this process when during the pain issues in the labor process they feel like they're out of control.
That is the long-term vision. Yeah. So right now I have 3 small children that are 5, 3, and not even 1. So I can't be at 30-hour labors. I can't be at 12-hour labors. Like we don't have family around here that I can just be like, hey, can you watch my kid for 30 hours while I'm like at this person's birth? So that's the long-term goal.
Yeah, but working with the team.
Access the midwives. I mean, you could raise their awareness, you know, so that they could actually be a sort of a pseudo you with a higher level, because people are gravitating, I think, more to midwives. At least that's been my
especially
experience.
since COVID too. I think a lot of people are wanting more home births and more like holistic, like natural.
It's pretty powerful stuff.
Yeah, it's super like empowering and it's super important. I mean, talk about the crux of life, starting at the birth process. You know, if you're gonna get one thing right. And there's so much that you talked about that I'm like, man, I wish we had. You know what I mean? Like, I wish we were aware.
And is that just like you just didn't know?
Yeah, no.
So,
I mean, and it's funny because you take it for granted, I suppose. People assume people know things, especially like chiropractor. You know what I mean? But we were so niched down from a very beginning stage that had plenty of blind spots. And that's in a chiropractic world, not to mention people who are not even plugged into body awareness and things like that. So I think this information is important stuff and critical stuff. So we had some conversations there about like leading into, and before we kind of potentially finish up, because you know this is all great information, I am curious about some of that post. I would assume if people do it right, they would already engage with you ahead of time, so there would be no need to know what to look for postpartum, because there would already be kind of a plan, and you know it'd already be there. You mentioned a couple of the factors to look for post-delivery. Can you hit those again real quick?
Yeah. So diastasis recti, which is that abdominal separation. You're not going to avoid it as the baby grows. Your stomach is getting bigger. Those muscles are separating. Typically, it will come back together. The people we see are when the core is not coming back together.
Gotcha.
And it might, like at 6 weeks is usually when we'll see a patient postpartum. By 6 weeks, it might not be totally together. So like there's things we can do to kind of help speed up that process. If you've had a vaginal delivery and you've had tearing and there's been stitches, oftentimes there'll be pain with sex or just like scar pain. So we'll work with that. Incontinence and prolapse issues. So usually if you've been pushing over 2 hours, the risk of prolapse goes up. So if you are in that category, like definitely get into a pelvic floor physical therapist and get things looked at. But even like if you're less than that, like you're still pushing and pushing force through the pelvic floor. So like prolapse issues, feelings of heaviness, feelings of falling out, incontinence, leakage of so that's leakage of urine, fecal leakage, constipation issues. So sometimes if there's certain degrees of tearing, your ability to like bear down correctly can be affected. C-section scar pain. So if you've had a C-section, sometimes people have scar pain. We'll work with that, and then just like re-engaging your core. So especially with C-sections, like learning how to use those muscles correctly again, while lifting your kid, while twisting, while putting the stroller in and out of the car, like different like important functional things that moms do.
And that's, I think, what, just from personal standpoint, that was the biggest thing that I think we probably underestimated, was the importance of that kind of stuff, because depending on personalities and environments, you know, sometimes there are those super mom syndromes where they're just doing everything, and it's kind of like you just went through a major surgery, especially with cesarean section. And with a newborn, you're bending and lifting and all of those things. So I guess to the point at hand, contacting a professional like yourself before you blow your disc, before you have pain with sex, before all of these things, just to get a baseline on where you stand after having such a major life event.
Well, even like, so even if you've had one kid and everything's great and you don't go to pelvic floor physical therapy, like the next kid is going to put more stress on your body. So like a lot of times if you're not going after the first kid, you might have more issues after the second kid. So like even if you feel like everything's great, like I always recommend just like 1 or 2 visits with a pelvic floor PT just to like get everything looked at and make sure things are functioning the way they're supposed to and back where they're supposed to be.
I love that. Now, if people want to get in touch with you, and I'm curious to open the floor to some questions from a clinical perspective on signs and symptoms and tests, but you've already listed a lot of the symptoms and things to look for. But for those that have been hanging out with us that may be curious, just to be like, yeah, no, I'm expecting, my sister's expecting, my daughter's expecting, like, how do people get a hold of you now, like in terms of, and we'll put it up on the show notes, but just in general, where are people going to find you?
So Google, Google search my website. I have a contact page that you can just like send me an email. You can text me too. I know some people don't want to call, so I have a text option.
And that's, I'm guessing, kineticpelvichealth.com? Is that the website?
Yes.
Or okay, good deal.
So
just looking it up on there.
Office or you work out of your house?
So I contract with another, like I rent space from them. So I'm there in
Cranberry.
evenings in Cranberry.
That's in a chiropractic. What's the name of the facility?
Grenier Health Solutions.
Grenier Health Solutions.
Yeah, they're right by the Dunkin' Donuts.
That's right. Everyone knows where Dunkin' is.
So.
Do you need a referral to come to you, or can people come direct
So
access?
I do have my direct access license, so people can see me for 30 days without a script. I tend to like to get ones right away just because then care isn't held up. So what'll happen is like sometimes I'll start seeing people and then we don't have a script and then it's like close to 30 days and it's like, oh my gosh, we need one to see this person tomorrow, and then it's like a scramble. So I usually have people within the first like week try to get me a script so that way we're covered.
Are you outside of the typical 3 days a week protocols?
I am, yes. So I do what the person needs. If things are really bad and someone's in a lot of pain and needs me more frequently, I'll do once to every other week. There's some people that I'm seeing every other month, every 3 weeks.
Insurance support that? Because they usually don't like to have those extended.
Well, I don't accept insurance. I don't work with insurance companies. So I cannot see Medicare patients. So I'm out of network, so people will come to me, they'll pay cash, check, HSA, FSA, whatever they want.
What do you need the referral script for then, if you're out of the networks? If they're paying, if it's a direct relationship?
I'm providing medical care. Like it's a, yeah.
That's fascinating.
And I
I'm not sure that I
send a
get that.
pair.
Yeah.
I spent so much time looking into Medicare laws. I'm just like.
Well, with Medicare, I understand.
Well,
but
there's
like,
people that do. So basically, health insurances will follow what Medicare do. So like, I have to. If people are submitting to insurance for reimbursement, which I provide them the super bill,
that
they
makes
need
more
to
sense.
have-
Yeah,
they
from an
need to have
out-of-network
a script
perspective.
and a signed plan of care.
Yeah.
So I do provide the super bills for people who want try to submit for reimbursement. And some people will get some back, some people don't.
Yeah.
Like they have to look into their out-of-network benefits.
Yeah, we could probably have, and this is the point where we're going to get a little bit more on the clinician side. So if you're hanging out and you want to bow out while we talk,
Can I just
nerd
add
stuff,
one more
yeah,
thing?
please do.
So I also work with pelvic pain patients. So these
Yeah.
are people who are not necessarily pregnant or postpartum. So it could be like 20-something-year-old who's never had a baby, having pain with sex. I have someone who's like frequently having symptoms of UTIs, but they never come back as UTIs. So that's a pelvic pain patient where there's irritation of the pudendal nerve. So like I also work with those people. Endometriosis, PCOS, those can lead to chronic pelvic pain conditions, and we can work with that
What
as
about
well.
postmenopausal women?
I can, because of well, I guess if they're not Medicare yet, I can.
So if they are Medicare,
Then I
they're
cannot,
excluded.
yeah. Because of,
Even though they private pay?
even though they private pay, because it's like a federal, it's very confusing and kind of annoying, because if a patient doesn't want to use Medicare, they should be able to not. Some clinicians are okay with having them sign something saying they'll waive their Medicare benefits. I am not personally comfortable with doing that, so I just chose not to
What
work
if they
with
don't,
Medicare patients.
what if they choose not to submit?
That's that would be the form that they would have to sign.
That
But
it's a waiver
yeah,
type of
but it can get tricky. So I've just chosen not to
Interesting.
bother with it.
Too bad. Really.
We're
Yeah,
kind of
it's unfortunate.
we're in a similar vein, and for those that are hanging out with us and curious how insurance works, there's in-network and out-of-network providers, but you're still doing the same thing. It just depends on who gets the reimbursement from the insurance company and if there's deductibles or not.
Yeah.
With Medicare, it's a little bit different because the federal government says that if you're of Medicare eligibility and you go to a doctor and they're providing a Medicare eligible service, then by law, that provider has to bill Medicare, because it's sort of like protecting Medicare folks from potentially, I don't know, maybe nefarious providers or price schedules, because usually people that are on Medicare have fixed income and things like that. So if the provider is providing a medically covered service by Medicare and you see them, then they have to bill Medicare, or they can't see you at all. One of the things that I learned in our journey through this quagmire of an issue is that there's a difference between a medical necessity and something being medically covered. So if medical necessity, whether it's an acute or chronic issue, is one thing, and if you're covering something that is medically covered, whether it's necessary or not, you have to bill, But if it's a non-covered service,
So
that's a little
wellness.
different. Well, maybe, because that's maybe not medically necessary, but covered, right? So if I adjust someone because their neck hurts, it's not only is it medically covered, it's also necessary. But if I adjust them for wellness, it's still covered, but it's not medically necessary based on Medicare's guidelines, right? But if I'm intervening on a criteria that's not medically covered, like a lot of the work that we do here would be considered experimental, because we use thermal imaging and we look at global postural assessments to determine when to adjust and when to back off. They don't cover any of that. And we don't bill for the adjustment. We bill for the time it takes for us to assess those non-covered services, right? So thermography, and interestingly, we could have another conversation potentially later. Technically, we're looking at pelvic unleveling, but those kind of services, Medicare doesn't reimburse for that at all. And they won't cover us if we don't adjust, because that's not even in their rubric. They just assume that we treat people like popping a Tylenol. So we've taken the stance that what we are providing in here is so far outside of what they would classify as chiropractic that it wouldn't even be a covered service. I might as well be selling you sneakers. You know what I mean? Because it's so foreign to them what we're doing. And you do have healthcare environments where providers are covering some things that are covered, but then they're providing some things that aren't. Like, again, if I were to sell a Medicare patient an insole for their shoe, Medicare, now I guess I shouldn't hold that line because I'm not sure if they do with prosthetics and things like that.
Or you'd have to have them sign an ABN to.
That goes back. That goes back to the
UPMC.
medically necessary versus
Yeah.
preventive. That's the
Yeah.
ABN. People think that's the
it's-
separator,
it's not.
but it's going from acute to chronic. There's a different line in the sand, which is covered and non-covered.
And this is why I just said I'm not dealing with it.
Yeah.
It's just not even
So-
like,
Including a large people
I
like
am,
that?
but it's
That's
not also not my passionate area. So like I
Yeah.
enjoy working with the pregnant and postpartum population.
That's a different
So
story.
like
Yeah.
the 20 to 30, 40-year-old range.
But that's good for us to know as providers, and it's also good for the people in the community to know. And it is a bit more like you said, your target market is in that pre and
The younger,
postpartum,
yeah.
which makes all the sense in the world. But it's a good thing you mentioned about some of the other services. You know what I mean?
Yeah.
Real quick, because I know I could chat about forever. I think Larry could too. We're both talkative guys, but I am curious. Is there? We always look at like signs and symptoms in healthcare. We've got our symptom list, our things to look out for. Are there particular signs, medical tests, observations in whether it's imaging, blood work, things like that we would look for, or just phrases that patients are saying that are maybe outside of the obvious symptoms that are flared up that we should be looking for to know, like, because as far as I'm concerned, anyone pregnant, I'm going to be like, hey, you need to make sure you talk to Amanda.
I mean, I feel like people are. There's some people that will tell you everything, and people in healthcare in general tend to be more of like the people that tell everything. People in the like small, like I feel like the population maybe that isn't healthcare don't tend to like necessarily say like, I feel like something's falling out of my vagina, or like it hurts to have sex. So I feel like asking some of those questions are the most important things. So like maybe from a chiropractic standpoint, like have you had bowel or bladder changes recently? Are you having like any lower abdominal pain? Or like maybe from an acupuncture standpoint, like are you having pain during different parts of your cycle? Trying to think what else, like dull aching, cramping, or like if they're pregnant, like hip pain, like almost like asking. I feel like a lot of times pregnant people will tell you their symptoms, but like maybe asking like more probing questions.
Yeah.
And if you don't want to be like, how does your vagina feel? Like just be like, are you experiencing bowel or bladder changes, or just like a little bit less.
Yeah, we were just reformatting our intake forms recently, and some of these potentially uncomfortable questions can be inserted into intake forms very often because it's less, threatening, I suppose, to check a box as opposed to having a conversation around it potentially. But I think those are important questions to ask, and those are questions you would ask more often than not postpartum, you're thinking, or just in general?
I would do it even in the pregnant.
Yeah.
Like, because they're like the baby's in there growing, like you're going to get pressure on the pelvic floor.
Got it. Oh, that's
I
awesome.
would suspect that a lot of times during treatment, you get a kind of cathartic response, and sometimes they start to tell you the rest of the story.
Yeah,
but they
it's
don't tell you
actually,
initially.
I mean, that's something I really enjoy about what I do is like just hearing people's stories. Like sometimes you'll get everything all at once, and other times people kind of hold back, and as you build that rapport, like they start to tell you more, and it's like 3 sessions
powerful.
in, it's like, oh, well, that's why you're experiencing what you're experiencing.
That's actually huge.
And then it
Larry.
helps me kind of like treat them better and get to their goals. And
That's actually the benefit of manual therapy technique, is that once you put your hands on somebody with good intentions, you're never quite sure what you get, but sometimes there's that cathartic release where they start telling you what they should have told you in the narrative, so you always think that you get the narrative all up front, but rarely do you get the whole story.
And I'm
that's even
one-on-one
something
with people for an hour. I do an hour session.
Yeah.
So like I've heard lots of things, and I feel like I have made good friends, if you could call them friends, and it's been great.
I think that's a really powerful observation in the sense that like some new moms are very, I don't know if the word's trepidatious, but they're, I feel like the appropriate question is, do you have someone, if they may not even want to talk to me about it, because maybe I'm kind of a guy or because who knows what, but it's like, do you have someone to talk to about this issue? You know what I mean? You don't have to tell me, but do you have someone to work through this? Because they maybe aren't in a place where they don't know who they could open up to about it, because maybe it's their first child, or maybe they have a small circle of peers or family or a medical team that's maybe just blind to some of the issues. But that's kind of huge. Like that.
I think Amanda's a powerful force. I'm sitting here, I understand what she does being a therapist myself, but I don't really. And so the more you're telling me these things, the more intriguing you sound, and the more information that I want to get. And I'm starting to think of a whole population that really would benefit seeing you before pregnancy. It would almost be like, they have standard routines that the doctors go through, once they identify that you're pregnant. The work that you're doing should be a concomitant part of that process if you really want to talk about women's health.
It should, and a lot of times doctors won't just refer. Like, a patient has to be like, I'm having this issue, can I get a script? Which is unfortunate.
Definitely, yeah,
because I've heard so many women and so many girls come in and they'll be like, I told my doctor I was having this leakage issue and they just said it was normal and it'll go away postpartum. But you have to be like, I have this issue, I want a script for physical therapy, and be very specific, because I think doctors just get overwhelmed with the mass number of people that are coming in, and
Yeah.
I don't know.
Yeah, no, I've found, and that was the whole point of the Pittsburgh Providers Group, and what I've found is that more often than not, it's independent practices that have the time and passion to look outside of their four walls, because for better or worse, God love them, folks that are within the system, they are overworked. It's not that most of them are not jerks, they're good people, but they're just in a system that doesn't allow for the time and space to think outside of that box a lot of times.
That's part of the reason I left.
Really? Yeah.
My old company.
And eventually,
film dominated, so we don't necessarily think esoterically or subjectively about our patients. I'm talking about I'm making a generalization, but you just see people that fall back on films. It's like, we'll get an X-ray, we'll get a MRI, we'll get a CT, whatever, as if somehow that's going to give me all the information I need, so I don't have to spend as much time with you, because it's all about getting people through the system, and so that the Dr. Welby thing is, that just doesn't exist.
Yeah.
it's hard.
So,
Yeah.
so even if you could be an integrated part of that process, so gaining the trust of the professionals, the specialists, realizing that there is a whole lot of thing that they don't have time for, whether or not they have interest of, but in the patient's best interest, allowing you to sort of be integrated in that process would actually be a globally positive experience for the population in general.
And that goes back to the conversation about in-network versus out-of-network, direct pay versus insurance reimbursed care, is that usually providers that want to spend more time are forced out of the networks because the networks negotiate their reimbursement rates, which necessitate a higher volume of visits within a certain amount of time. And so it's important for patients to understand that the reason a lot of these specialists and providers are out of the network is because they've chosen to spend more time with you. And like most things in life, you're going to get what you pay for to a certain extent. And it doesn't, and again, this is not a personal dig on people that are in network or whatnot, because a lot of times it doesn't have to do with them personally. It's just the infrastructure of our healthcare system is such that there are limitations to it. And
I think
it's
people
unfortunate.
don't necessarily even understand how insurance works.
Yeah.
If your deductible is $3,000, you're going to be paying that until you meet the deductible. So you can go in.
So regardless
but
of in-network
you're
or
still going
out.
to get that bill at the end of your session, and chances are it's actually going to be higher than if you were to come to me for an hour and just pay and submit for reimbursement.
We just need to educate patients, the population in general, that as clinicians, we are providing a service, and therefore you have control of that process. So you should demand the service that you're paying for, as opposed to simply being a passive participant in the process, which is like, well, this is what you should do. Somehow it's all top down. It should actually be organic. So it's how do we make this?
Well, even if you think about going to get your hair done, you go to a hair salon and get your hair colored, you sit there, and I mean it's $300.
Yeah.
And we're doing. I'm doing an hour of skilled care with you and charge less than that. So it's just
to take a brand slogan for, I think it's UPMC, you're doing life-changing medicine, right? I thought that was such a great slogan they had. I think it was UPMC or Blue Cross Blue Shield. It's life-changing medicine. It's that's legit. When you're doing this type of work, you're doing life-changing stuff. And to your point, and God bless you for bringing it up, because it's true, we all invest in the things that we value, and we're so used to and kind of entrained into a way of doing things. But if we actually step back and look at the value of what we're actually paying for, and if you want a success, maybe if you want to stack the odds in your favor for having a birth process with less complications and doing the pre-work with pelvic strength and stability, makes sense from our perspective chiropractically in terms of balance. I'm sure we could talk about functional work, we talk about acupuncture and different things, there's so many things you can do, but insurance won't cover any of it because it's not acute crisis. It's, but again, to your point, this is like one of the,
because it keeps
one of the
you
most,
out of that medical system as well. Like,
yeah, but talk about a investment opportunity for your life and the life of your child. Like to your point, it's like it's such a worthwhile investment because if you're investing in anything, I mean, give me a break.
Yeah,
You know what I mean?
And moms do have a hard time like making time for themselves. Like you have a lot of little kids, and it's just like crazy. So carving out an hour, or even to just like drive in. So I also do offer in-home care. So I
was going to ask you that earlier.
Yeah, so I will in the Cranberry Township. So basically, people have to be within 15 minutes of Victory Family Church for me to come into the home.
Gotcha.
What does that mean in terms of drive time? So
it's about 15
outside
minutes.
Of your domain?
If they're within 15 minutes of Victory Family Church, I will come to their house. If not, they'll come to me.
Was that drive time or is that like traffic time?
Like if I put it on GPS and it's more than 15 minutes, I don't know.
Larry's getting technical here. He's like, what about on a Tuesday at 3 p.m.? What is that?
Yeah, I mean, if I have to go on 19 at 3 to 5 p.m., probably not. Yeah, but if it's like, I don't know, if it's like a Saturday morning, like it's going to be different.
I feel uncomfortable asking this because I'm a man, but I'm wondering, do women actually that struggle with delivery, do they see it as a them problem? You know, like somehow I should be more something because it took me so long to deliver this baby, like I should have been better at it.
No, I think it depends on the person and the support around them and their interpretation of the birth. So like some people could have a super traumatic, like what I would view as a traumatic birth, and they could be totally fine. Other people can have what I would view as a great birth and it be traumatic for them. So it kind of depends on.
That's such a good piece of
like
awareness. That's awesome.
I mean, one of my friends had like a perfect birth. Like I was like, wow, like that baby just walked right out. And she was like, it was so traumatic. I think because it was so fast.
And that goes back to your social media thing, is that we have perceptions based on what we see, but it's all so individual, like the experience there. That's
so I mean, and also like my second birth was super fast too. Like he was out within 2 pushes and we barely made it. But my husband, like I felt like it was great, like this is awesome. My husband was super traumatized by it because he almost had to catch the baby. So like, even though like you're thinking about the mom, like the dad is also important to incorporate into the whole healing process. So.
That's awesome. We could probably talk for another hour. But I know this is like really, really cool. I do want to maybe round us out here though, but I just want to thank you for taking the time. I know your time's extremely valuable, especially with those kids and all that you do. But please, I would encourage anyone that's hung out with us, and especially to this point, we've been chatting about a lot of stuff, to follow up with you for sure. We will engage in the comment section for sure. We will share this. I always hopefully said this at the beginning, share it because you don't even know whose lives you could impact, because how many, what are they, the 7 degrees of separation or whatnot? Like there may be people in your circle of influence that are struggling with these issues, but we don't know because it's a private issue. So you just share the information and hope it changes someone's life. But I will leave the last, anything that we didn't go over, Amanda, that you would like to go over, and then we'll sign off. Anything we did, anything I forgot to go over, any last minute words for folks hanging out with us?
No. I mean, I just feel like it's really important to at least go to one physical therapy session while you're pregnant and at least one postpartum.
Yeah.
Because you can think things are great and chances are they're not.
Yeah.
Like just getting your core back, getting your pelvic floor back, it'll protect you in the long term. Yeah.
Yeah, and you deserve it. I mean, I think
make time for yourself. You can bring your kid. Like, it's fine.
Yeah, I don't know. I said I'd give you the last word, but I'm thinking about something and I apologize. But like, I swear, I saw this recently and it just felt so right. And it was not to get, I don't know if the word is political or not, but like somehow the rearing, delivery, and or I should say the pregnancy, delivering, and rearing of children has been relegated somehow into a less than kind of like concept where professional statuses have been put as a priority over something as miraculous as this process.
Yeah.
And so when it comes to like investing in the success of this like all important aspect of human existence seems like something we should all be putting on a pedestal. You know what I mean? somehow it gets like,
know.
I don't have
I
time or this or that. It's like,
I mean, I just think the miracle of birth is just like, just pregnancy, like your body is designed to carry a baby.
Insane,
Like you're literally growing a human being and they're coming out of your body. Like it's just a beautiful thing. And like to just be a part of a women's journey with that is just like, it's awesome.
Yeah.
And just like helping moms appreciate it and just get back to things they like to do. And yeah, it's great.
yeah, it's pretty awesome.
Yeah.
Thank you. Thank you for what you do. Thank you for taking the time. Thank you guys in-house for hanging out with us. Those who are listening back to the playback or watching it. I think we'll end with that. It's pretty powerful.
Yeah.
All right. We'll see you guys. Bye now.
See ya.